Hi there, Tracy from Kazadans Equestrian. Welcome to this week's video. If you haven't been to my channel before, please don't forget, subscribe, like, share. Every bit of support that I get around this channel helps me keep it going. This week's video, I'm going to tie together the lameness series now and give you a step-by-step approach to looking at your horse's gait, and one, deciding whether or not it is lame, and two, trying to work out some ideas around where and why. So I'm going to look briefly through 8 steps to follow. Now, step 1 is actually deciding whether or not your horse is lame. A lot of people wait until they see a very obvious limp or very obvious asymmetry. But the idea for me around this series is to get you to notice this earlier, because as I've mentioned, the earlier you see it, the better the prognosis for your horse, the better we can get treatment early, and it's likely that you're going to prolong your horse's ridden career. Step 1 is to actually look at your horse regularly. Now, that may be getting somebody else to run out, or go back and look at those videos that in the first video I asked you to take, which was the up and down, etc., and have a look if you can see any asymmetry. Now, I hear a lot of people that say to me, that's just how my horse goes. Now, this may be the case. However, it is still a lameness. If there is nothing you can do about that asymmetry, that's okay. But actually managing that is the best thing. So imagine that you have a permanent limp. There is no doubt there is something that causes it. If you're not walking symmetrically and correctly, there is a reason. It's a tightness, it's a soreness, it's a, may even be a bone malformation, conformational issue. Whatever that is, it actually needs management. So, for example, if your horse's natural way of going is to slip to one side, then you're going to have to be aware of that and manage the symptoms that may occur because of that natural asymmetry. When we're determining if there is asymmetry, what are we looking for? Any abnormal neck or head carriage, abnormal tail carriage even. Does it look like any limbs are falling into an imaginary hole? Or do any of the limbs look like they're dragging an imaginary weight? Any alteration of movement from asymmetry, diagonal pairs at trots, anything where it's not symmetrical is a lameness. So step 1 is to identify that. Step 2 is to try and work out which region this lameness is coming from. Is it the front? Is it the back? Is it the right side? Is it the left side? How do we do that? Which side is it shifting weight to, for example? Is the weight being transferred from behind? Another really good way to see this is at a trot, your horse should be showing the diagonal pairs tracking up correctly. And not only that, but you should see a natural and also symmetrical V. If the forelimb is staying under longer and the hind limb not coming over so much, you'll see a slightly skewed V. This again is a lameness. Is there any obvious way your horse is either shifting weight or load or doing something with its body to maintain balance? So step 2 is try to work out which area that you're looking at for your lameness. Step 3, this one's really important and we often miss that, and that is referring to my last week's video, which is the lameness a weight-bearing lameness or a non-weight-bearing lameness? This is going to tell us if it's a biomechanical or structural interference or a very pain-related lameness. So this is an important step. It also guides us as to whether it is bone, soft tissue, or any particular region that are prone to lamenesses, either being weight or non-weight bearing. At this point, we also want to see, by using some of maybe the directional stuff, is it limb related or is it axial skeleton? So is this the head and neck? And you'll see in one of my other videos, I talk about when you make a circle smaller, there are some very obvious changes that a horse makes if the soreness or lameness is related to the back or neck. Now we're step 4. Step 4 is determining how severe is the lameness. Now, when I talk about falling into an imaginary hole, of course, the imaginary hole could be 2 centimeters deep or it could be a foot deep. So using your powers of observation, I want you to have a look at how deep is the hole the horse is falling in, the imaginary hole, and also how heavy is the imaginary weight that your horse may be dragging, or how much deviation from symmetry in the axial or neck and back symmetry is occurring when you follow all the different lameness tests that you can do. Step 5, have a look at the gaits. Is it obvious at a walk? Is it obvious at a trot? Is it obvious at a canter? And remember, let's include direction in that as well. Is it obvious to one way to the other? And also the use of transitions. Does it become more obvious in an upward transition or a downward transition? Is it obvious more or less obvious at a faster pace or a slower pace? Go back, once you've decided that, go back and look at those videos, because we're really starting to direct in here the possible causes for your horse's lameness. Step 6, is your lameness consistent? Does this occur sometimes? Is it intermittent? Intermittent lamenesses are much more difficult to diagnose, so it's actually even more important that as an owner, you gather as much information about that when it is occurring to be able to talk to your vet. Step 7, all of the external factors I've talked about, go and see which ones of these either exacerbate the condition or make it better, up and downhill, backwards, forwards, circles, straight lines. Use hard surfaces, soft surfaces. Use all of these things to determine which makes it better and which makes it worse. And this again gives you a lot of information to help determine the direction or the area that you're looking in and possible problems. Step 8. Now just have a look at the appearance. Is there anything obviously different about any of the limbs? Is there obviously anything different about the head and neck when you touch it, when your horse moves? Is the horse different when it stands? Does it stand slightly under itself or slightly camped out? And also in the flight, is there something wrong with the arc of the horse's limb? Does it move slightly differently in the air? And do all of the joints move the same? This is can be particularly obvious in the hind limb. So you may see that one limb doesn't move its hock and stifle quite correctly. So this can also help you work out or at least narrow down where and what is causing your horse's problem. So that's a really quick tie-up, but you're going to have to look back at the other videos to get some of the information that I've suggested you do in this one. And please remember, this is not to diagnose and treat your horse's lameness on your own. The idea is that as an owner, we owe it to our horses to be able to pick up these lamenesses prior to them becoming very chronic or very severe. In studies, they've found that most horse owners don't recognize these minor symptoms of lameness, and this is when we have really extreme outcomes, poor outcomes by the time they get to the vet. So the idea is gathering this information, using your powers of observation and practice looking at your horse or horses so that you can recognize even the minute changes. And at the very least, even these tiny changes, please rest your horse to see if it can get back to normal. I get questions a lot from people, for example, that, I've had the horse locked up for 2 weeks and it's still lame. Well, if you've twisted your ankle, it takes more than 2 weeks to repair that. Remember, we cannot tell the horse to be still. We can't give the horses crutches, and often we can't even bandage to help the movement. So the horses are going to continue to move during this lameness. All soft tissue injuries do require at least 6 weeks, and with a horse, I would tend toward resting for 8 weeks, even if they look paddock sound. The fact that your ankle, if you've sprained it, looks and feels okay to walk does not mean you can go out and play a game of basketball or football. So let's apply that to the horse, because they can't tell us. The earlier you go back into normal activity, if there's a problem with the horse, the more likely you are to get a severe or re-injury. Some of the tissue that gets laid down when your horse is repairing an injury, it looks okay, but it's also more brittle and not as flexible and more likely to tear if the horse is reintroduced to injury quite quickly. The other thing, if you do have a serious injury, please be aware of the concept of proprioception. Proprioception is where your horse, basically its brain connects its movement or the position of limbs in time and space. I have a video on that to explain it as well. Quite often people wait for the leg to be healed and go straight back into work without reminding the horse how and where that limb works. They then have a muscle memory of the injury and they're highly likely to re-injure themselves. Legs are so important. As we say, no hoof, no horse. It's also no leg, no horse. And for a horse, lamenesses, minor tears and pulls can be detrimental. They can easily spell retirement for your horse, and even worse. So let's treat our horses with the respect that we want them to treat us. Notice any minor lamenesses, use some of these techniques and get on to treatment and get on to veterinary intervention early, so that we can give them their longest riding career and happy and pain-free as we possibly can. Thanks for listening. If you've enjoyed this video, please share it around. Don't forget, again, subscribe to this channel, like it, add some comments. If there's something I've discussed and you would like some more information about that, please put it on the YouTube comments and I'll have a go at trying to get that, get a video done for that. So thanks for listening, and I'll see you next week.